Hi, welcome to this presentation about the project Patient Empowerment and Patient-Reported Outcomes using mobile health. My name is John Black-Kabuche, a postdoc at SPIDER at DSV, Stockholm University. And these are my supervisors. Patient empowerment is about giving patients the knowledge, skills, and room or encouragement to participate in their care. It recognizes patient autonomy and community and cultural differences, ensures that the patients understand their role, which is very crucial in non-communicable diseases such as cancer and mental health issues, and also in low and middle income countries where these NCDs are an increasing public health issue, and yet they're under-prioritized in the face of other competing issues like HIV, AIDS, tuberculosis, malaria. Along with patient empowerment comes the concept of patient-reported outcome measures, which are basically self-assessment, where patients report issues like satisfaction with care or quality of life, or assessing their side effects or symptoms. In the developed world, especially, these patient-reported outcome measures or PROMs are often collected using online tools or apps. But this might be problematic in low and middle income countries like Uganda, given the challenges accessing smartphones or the internet. And yet in these settings, given the challenges with the healthcare system, so limited healthcare workforce and limited resources, being able to empower patients and being able to collect patient-reported outcome measures would be very crucial in improving healthcare delivery. So some of the issues that we have to deal with in this project are to develop validated measures and having them converted into digital versions that are possible to disseminate or to administer using contextually appropriate technology. And in this case, we'll talk about the technology that we've been working on, which is basically setting up a simple patient telephone device line. For now, we are setting this up in mHealth, and we're using it to provide mental health information and that device to patients. And we're also hoping to use this to collect these patient-reported outcome measures. So this followed, of course, a user-centered design approach, and we used implementation science frameworks to understand patients and the context and be able to create requirements and design the service based on that. Here you see the consolidated framework for implementation research, or CIFA, that we used to assess, we drew on to inform the user engagements, focus discussion, design workshops, and feedback meetings. And then with that, we're able to create the intervention. The intervention has three components, majorly. The automated part, where information that is pre-recorded in audio format and translated in different languages is disseminated using a computer. So patients can consume it in a self-service manner by dialing into a telephone system and then select off a menu. This is called interactive voice response system. This is important because with automation, you reduce the burden on the limited health workforce. We also have live calls, of course, where patients can speak and ask individualized questions to nurses who answer the calls. But we also have peer support workers, and peer support workers are an important resource. They're basically patients who themselves have mental health issues, but they are recovering, and they can use their personal experience to help others. The graphic here shows the topics that we identified and we implemented in the service for now, but we are learning and collecting feedback to see if we can improve those topics. So in terms of evaluation, we've conducted a survey of about 200 plus users of this service, and we're assessing usability and perceived utility. Analysis is ongoing, and we are going to work on the manuscript soon. But in brief, there has been a very positive reception of the service. We're having callers calling in from all over the country, sometimes up to 8 hours away. And they call in with a lot of different issues that some of which we didn't anticipate. For example, issues about identity and sexual orientation, in addition to the usual mental health issues like depression and anxiety and stress. We get about 50 callers per month, which might seem small, but we have not advertised this service aggressively as we are still evaluating it and learning. We don't want to get overwhelmed. The next steps are going to be validating these EPROMs, as we call them, in which case for us, it's going to be audio questionnaires that we want to administer using interactive voice response. And we also want to test this service in another healthcare domain, specifically cancer or cervical cancer screening, where we want to use the service to follow up on women that have undergone screening, assess how they're doing, and if they have any complications that they can report themselves. So that's the service, the project that we're working on, and please get in touch if you're interested so that we can collaborate and enjoy the rest of Digital Eyes in Stockholm.